Okay, so I'm gonna keep this short just because, we're right before lunch and I don't want to hold anybody up from that pizza. So here we go. Anyway, so my name's Liam White, and I worked in the office of the Chief Medical Officer of the Yukon. And so the Chief Medical Officer is responsible for the legislative responsibility of the Department of Health and Social Services to protect public health. This includes a wide range of things, all the way from chronic health conditions, to infectious diseases, to health promotion, which is what specifically I was in. And so my practicum essentially ended up being how to adapt the current smoking cessation program, QuickPath, to be more culturally safe. And so doing so prepared policy recommendations and also prepared a literature review. However, that originally wasn't what I was supposed to be doing there, because when I got there, there was a clear need to have a relevant database of best practices for culturally safe, just for anything dealing with smoking. Because as we know, smoking is a cultural practice. However, it really shifted to show that there's a need for the specific smoking cessation program, QuickPath, to be better, because there was not too much knowledge about how it was culturally safe, or even if there was aspects of cultural safety within it. And so, yeah. And so just before we get going into what exactly QuickPath is and all this jargon, I do want to say that the practical skills from the BA, such as the cultural safety and competency, the written and oral skills, those communication skills are important, integration of evidence-based literature, and interpersonal communication, because I was dealing with a wide range of different personnel. And then the values were the political awareness, indigenous knowledge, and diversity, and again, cultural safety. So I do apologize. I don't have a slide for QuickPath because I forgot it, but whatever. So what QuickPath is, it's a free smoking cessation program you open to all Yukoners. You actually don't even need an address to sign up for it. So it's administered by Health and Social Services, and each person who enrolls receives individual care, and that they can get access to guidance counselors, whether it be online, in person, or over the telephone. And they also receive nicotine patches. There are no vapes or any other types of nicotine available through this program. However, if someone finds them useful, they can keep going with it. The one thing to note is that this is proven to work. It's just that there isn't much public data for this, because it's basically we're just going off the word of the people who work in there, because the Yukon has very little tracking for everything. And also another thing too is there's no specific tracking of Indigenous people in this entire thing. They don't keep a record of who's applying for this. They don't keep a record of who actually successfully quits. There's no follow-up. So that's one thing that we do have to get into. And another reason why is because there's 51% of First Nations people in the Yukon smoke. So it's incredibly high. And then the other one is that's 26 of all Yukoners smoke, and versus 17% in Canada. Anyway, so on to the policy recommendations. So for this one, the first one is just to advertise that there are culturally safe components. And the main rationale for that one was that First Nations people are more likely to use services if they seem culturally safe. And there are culturally safe practices within it. However, they're not well known, so if they collaborate, maybe they can advertise these out to the community. The second one is actually just hire more Indigenous staff. And this one would allow people to seek guidance from their own elders, whether it be elders, health practitioners, whatever, because Indigenous ways of health and healing have better health outcomes. And then lastly is one, this responds directly to a call from one of the non-government organizations called the Council of Yukon First Nations, which specifically requested more youth and minor smoking cessation programs, because people who smoke when they're young rarely quit when they're older. So this is a huge issue for specifically urban First Nations peoples in Whitehorse. And so I do want to finish just up on the Truth and Reconciliation Commission, specifically number 19. It's because these programs, because they're not tracked that well at the moment, and we do have a huge issue with smoking, these ones are, this one's really critical when you're talking about these addictions, chronic illness, whether it be, and we also have mental health issues as well, but these ones specifically all relate to smoking. And for example, lung cancer is 9 9 out of 10 cases of lung cancer come from smoking. So, there we go. Any questions? Lunchtime?
Thank you. Thank you, Liam. That was a great presentation. My question is, did you have any representatives from oral health? I myself work as a dental hygienist, and it's part of my daily practice to promote tobacco cessation. So were these people at the table, or were there in discussion developing partnership with local oral health providers?
Unfortunately, no. That is definitely a gap that would have to be looked at. As far as I know, because obviously in Canada, dental is not covered by any medical except for non-insured health benefits. There wasn't really too much discussion about oral health, specifically about upkeep or anything like that. There was a bit of it in some of the literature that it would just be oh, smoking's bad for you and bad for your teeth, and that was really the only message in QuickPath. So it's something that would have to be explored in the future.
Yeah, because I would see it as a more supporting, platform for what you're doing, because that information can be reinforced. And of course, if people are able to go to the dental offices, right? So there's more regular contact rather than coming from the medical field.
Oh, absolutely.
Any last question for Liam? No? Okay, so I guess that means we're breaking for lunch.